Good afternoon. This is Michael Ostrolenk, and I'm talking with Dr. Jane Orient, Executive Director of the Association of American Physicians and Surgeons. Good afternoon, Dr. Orient.
Good afternoon.
Welcome back. You
Pleasure.
recently had an op-ed for the Washington Times entitled, "Boomers to Congress, Let's Make a Deal. Some Seniors might Trade Social Security Benefits for Tax Exemptions." A very well-written piece, very informative, with some very interesting ideas. Please tell us about what you wrote and some of your ideas.
Well, the reason I wrote that piece is because I passed a strategic birthday, and I noticed that more and more people are beginning to think about the future of Medicare. I am at the leading edge of the baby boomer generation, and we are going to destroy Medicare. The politicians can talk about we're going to save Medicare, we're going to protect Medicare, but they're not telling the truth about the dimensions of the problem. We just now had another trustees report that sounds the alarm that says Medicare will be bankrupt by 2024, or if you don't permit double counting and other techniques, it'll be bankrupt by 2016. But the fact of the matter is, it is already spending more money than it takes in through the payroll tax, and it's having to redeem those IOUs that are the only thing that's in the trust fund through tax money and borrowing. And this absolutely is not sustainable. The unfunded liabilities, which means the promises they've made without any money to pay for them, are at least $38 trillion and probably a great deal more. So what is going to happen? We've been kind of kicking the can down the road, denying the urgency of the things, but the day of reckoning is approaching, and the system is going to crash and burn no matter what these politicians say. And I think it's time for us to think about how can we change the situation, how can we relieve the pressure, how can this leading edge of baby boomers do something to save both their country and themselves by finding a way out of this system.
And when you say out of the system, how would that actually happen? And then how would those same seniors get medical care?
Well,
if in fact they've been relying for the future to have Medicare as their provider of insurance.
Well, what happened to us was done to us by Franklin Roosevelt with the Social Security system, and then by Lyndon Johnson with the Medicare system. Is he wanted a system that forced everybody into it, nobody out. And what Johnson did in 1965 was see to it that all seniors' medical insurance policies were canceled, all of them. You know, the insurance companies couldn't do that. We can hear complaints about those wicked insurance companies canceling people's policies. Well, no, they could not cancel an individual's policy, but Lyndon Johnson pointed out you can cancel all of them, and he insisted that they do so. And that means that everybody in the United States, virtually everybody, is in the situation of having Medicare as the one and only source of insurance once they pass the retirement age. There are some supplemental policies. There are very few policies that are primary to Medicare, but almost everybody is dependent on Medicare because there just isn't any other insurance that they can buy. So something's got to be done to help with that problem if we're going to enable seniors to be able to make an exit and get themselves off the list of unfunded liabilities of the government. That means to say our children and grandchildren are going to have to pay for.
Well, so let's actually walk through a senior. We'll just do like a test case. Well, presently there's not any insurance products for seniors except, as you mentioned, some supplemental ones. So even if they left Medicare because they decided they wanted to save, future generations from having to pay for it, there's no other choices in the marketplace. So with that said, then would you suggest that laws be passed that allow then for new insurance products to be introduced in competition and such?
I think that we could entertain removing any barriers to such policies. I mean, the biggest barrier is just that there's no market for it, and there's no actuarial figures, and so on. So it's difficult to do. But the fact is, despite what some Supreme Court justices seem to think, insurance is not the only way to pay for medical care.
Right.
And while you may say people like me, or we're just being altruistic and thinking about the younger generation, in fact, we're thinking also about that Independent Payment Advisory Board, the death panel, which is a functional equivalent of that in that it's going to decree what can be paid for and what can't, and pressuring physicians to lower the liabilities of the system by just getting rid of them, allowing them to die early, and so on. And I do not want to be in the situation where my doctor is better off if I'm dead. I would like my doctor to be glad to see me and to want me to stay alive because I am a source of his livelihood rather than just a constant drain on his assets.
Now, what would be required in order for people as individual citizens to drop out of Medicare?
I think that they have to have some realistic belief that they can survive without it. Now, Social Security, probably a lot of people can see surviving without that. It was always meant to be just a supplement to your income. Even my grandfather, who drove a laundry truck, understood that, and he never expected that he would be living solely on Social Security after he retired. So a lot of seniors have accumulated enough savings or assets to survive, perhaps even to do better than on Social Security. And they may have to sell their assets, which is why we have to look at this gains tax that taxes these phantom gains that come from inflation rather than from the real appreciation and the value of the assets. But if seniors could see that yes, they could manage without Social Security, a lot of them would choose to do so. Plus, a lot of them would like to continue working. And right now, I know of some seniors who are taking their Social Security while they're still working, and it just about offsets the amount of payroll tax that they have to pay. So if seniors could be allowed to work without paying payroll taxes, many of them might find that it's for them financially it's a wash for as long as they can continue to work. Medicare is a bigger problem, as I say, because there is no real alternative insurance at the present time, although I think this could develop over time. And one thing I suggested in the op-ed piece was for the government, instead of paying continually for all of the little expenses that senior citizens incur, they could just make available a critical illness policy that would just pay an indemnity for a certain list of critical things like cancer, stroke, heart attacks, and so on. And instead of having all this administrative overhead and so on, just give the senior a certain amount of money, figure it out actuarially so the government in the long run will be better off, and the senior would be protected against a catastrophic loss. And then I think a lot of things might spring up. For example, really high deductible insurance policies to cover excess expenditures. Like if the indemnity from the critical illness policies was $100,000, you might have a very affordable form of insurance that would cover up to $1 million if you had an illness for which the treatment costs more than that.
And with that said, then seniors would have to pay out of pocket for kind of their daily medical expenses, then not catastrophic care, but other things they might be seeing their doctor for. Is that what you're suggesting? Exactly.
That's how medicine has been practiced for centuries. It's how seniors and all Americans really paid for their medical care, as recently as 40 or 50 years ago. When most medical bills were paid out of pocket, there was something called major medical, and what major medical meant back then was if you had to go to the hospital or have an operation, the insurance would reimburse you for your bill. But almost all medical expenses, you paid the same way you paid your grocer.
I wonder, though, if you have I wonder what percentage of seniors you'd have to opt out of the Medicare program in order to see the benefits for a longer-term sustainable system. I still would imagine that down the road it's still going to collapse. That what you're doing is you're kind of releasing some of the pressure and giving us more time to deal with it. Is that what you see from this?
I think so, and it would be protecting the most vulnerable people who could not possibly think about opting out. They become dependent on it, and harm has been done to them, but you can't just really leave them in the lurch. And I don't know what would the critical mass be to make this pay. I hope that some serious number crunchers will look at this and see. And a lot of people are assuming that, if you give people a chance to opt out, the 40-year-olds will do it in a heartbeat. But the older people, as they're approaching this bonanza of Medicare benefits, are not going to want to do that. Well, I think that that's a mistake to think that way, because I think a lot of seniors are looking at what's happening down the line. They're seeing how much trouble some people are having finding a doctor to take care of them. Yeah. They can look at the finances and see that there's going to be more and more constraints on the medical care they'll be allowed or able to purchase, and they'll be thinking about this. How can I save myself from the coming collapse?
Well, this is very interesting, Dr. Orient, and I do hope people take you up on your suggestions and look into it, because obviously if Medicare is going to collapse in 2016, or if we play financial games no later than 2024, something has to be done. And, unfortunately, we don't seem to have the political will to do anything in the short run in terms of majorly modifying the Medicare program and creating a true free market. But perhaps what you're suggesting is kind of intermediary stage of moving us in the right direction. Any other further comments, Dr. Orient?
I think we need to look at this realistically. Pretty soon there's going to be like 2 workers supporting every retiree, and seniors may think they're really powerful in the voting booth, but how are they going to see to it that just two young people will be supporting an old person between them? I mean, this is just not going to happen.
Right. So not only does Medicare need to be revamped and looked into and created in a more sustainable manner, but obviously Social Security and Medicaid too. It's obviously another program that's going to bankrupt us in the near future. Well, thank you very much, Dr. Orient. It was a pleasure to talk to you again.
Thank you.